Hello, I'm Dr. Day from Dermatology Department Hospital, Queen Elizabeth. Thank you for participating in my study on assessing knowledge and attitude on scabies among primary health care and hospital medical doctors. Kindly fill out the pre-lecture questionnaire before you proceed to watch this video lecture. You are then required to fill out the post-lecture questionnaire after this video lecture. So let's recap, and hopefully by the end of this video lecture, you'll be more confident in managing and advise patients on scabies. An estimated 200 million people worldwide suffer from scabies at any one time. Up to 10% of children in resource-poor areas are affected by scabies, most commonly in hot tropical countries and in areas of high population density. In 2017, scabies was included as neglected tropical diseases by WHO. So what is scabies? Scabies is the infestations of skin by the human itch mite named Sarcoptes scabies hominis. The microscopic scabies mite burrows into the upper layers of the skin where it lives and lays its eggs. And this actually triggers a host immune response that leads to intense itching and rash. This may be complicated by bacterial infections, leading to the development of skin sores and can cause septicemia, heart disease, as well as chronic kidney disease. This diagram shows the life cycle of scabies mites. Started off with egg, larva, protonymphs, tritonymphs, and adult scabies mites. All this process takes around 7 to 10 days. So how soon after infestations do symptoms of scabies begin? If a person has never had scabies before, symptoms may take 4 to 8 weeks to develop. An infested person can spread scabies during this time even if he or she does not have symptoms yet. If a person who has had scabies before, symptoms appear much sooner after exposure, which is 1 to 4 days. What are the signs and symptoms of scabies infestation? First of all, patients might come to you with intense itch, especially at night. They may present with papular itchy rash or vesicles and scales as well. And the common sites includes wrist, elbow, armpit, webbing between the fingers, external genitalia, waist, belt lines, buttocks. There might be tiny burrows seen on the skin, which is raised, crooked, gray-white skin-colored lines. Some of the lesions may be altered by excoriations, eczematizations, and secondary bacterial infection. This diagram by CDCs has illustrated the common areas of scabies. Figure 1 shows clinical features of scabies in infants. You can see that there are vesicular pustular lesions on both hands and the web of the fingers. Figure 2 shows clinical features of scabies in infants. Figure 2a, we can see there are papules and burrows on medial aspect of the feet. Figure 2b, vesicular pustular lesions on lateral aspects of the hand. Figure 2c, this patient has scabies nodules in the axillary region. Figure 2d, this patient has diffuse erythematous maculopapular eruptions and scattered nodules. So what is crusted scabies, or what we call as a Norwegian scabies? This is a severe form of scabies, occurs in some persons who are immunocompromised, elderly, disabled, or debilitated. Thick crusts of skins contain large numbers of scabies mites and eggs. They are very contagious to other persons and can spread the infestation easily, both by direct skin-to-skin contact and by contaminations of personal items. This group of patients should receive quick and aggressive medical treatments to prevent outbreaks. This is the pictures showing patients with Norwegian scabies. You can see that there are very thick crusts over the palmar surface of his hand. So the common question that you get from our patients is, how did I get scabies? Patients normally contact scabies by direct, prolonged skin-to-skin contact with a person who has scabies. A quick handshake or hug usually will not spread scabies. They are more easily spread to sexual partners as well as household members, or as any shares of clothing, towels, or beddings used by infested person. So how is scabies infestation diagnosed? This can be diagnosed based on clinical appearance, distribution of the rash, and presence of burrows. Diagnosis of scabies should be confirmed by identifications of mite eggs, or mite fecal matter. Scabies infestation in healthy persons, they will normally have 10 to 15 mites. However, in crusted scabies, there are thousands of mites that renders them highly contagious. How long can scabies mites live? On a person, scabies mites can live for as long as 1 to 2 months. Of a person, scabies mites usually do not survive more than 48 to 72 hours. Scabies mites will die when they are exposed to a temperature of 50 degrees Celsius for 10 minutes. Can scabies be treated? Of course, yes. Products used are called scabicides, which kills the scabies mites as well as their eggs. And it should be applied to all areas of the body, from neck down to the feet and toes. Subsequently, patients need to have a change of clean clothes. Who should be treated for scabies? Anyone who is diagnosed with scabies, as well as his or her sexual partners and other contacts who have had prolonged skin-to-skin contact with the infested person, should be treated. So all patients should be treated at the same time in order to prevent reinfestation, and retreatment may be necessary if itching continues more than 2 to 4 weeks after treatment, or if new burrows or rash continue to appear. In general, how long does it take after treatment for the patients to be non-infectious? It will be around 24 hours. The mite should begin to die within few hours of applying the treatment, but most of the people can return to work or school within 24 hours after treatment. Can scabies be spread by swimming in public pool? Scabies is very unlikely to be spread by water in swimming pool. Only about 10 to 15 scabies are present on an infested person, so it's extremely unlikely that any would emerge from under wet skin. Also uncommon, scabies can still be spread by sharing a towel or items of clothing that has been used by a person with scabies in the swimming pool itself. How can I remove scabies mites from my clothes? Scabies mites do not survive more than 2 to 3 days away from human skin. Items such as bedding, clothing, and towels used by a person with scabies can be decontaminated by machine wash in hot water and drying using the hot cycle or by dry cleaning. Items that cannot be washed or dry cleaned can be decontaminated by removing from any body contact for at least 72 hours. So let's discuss about the treatment for scabies. As a general measures, patients need to be provided with detailed information about scabies infestations and therapeutic options, including the amount of drug to be used and the proper administrations. Topical treatment must be applied to the entire skin surface, from jawline downwards, including all body folds, groin, navel, external genitalia, as well as skin under the nails, especially those with crusted scabies. Patients with scabies and their close physical contacts, even without symptoms, should receive treatment at the same time. Prescription must be provided for all household members and sexual partners. In the subsequent few slides, we have tables showing the treatment options that we have in Malaysia. These tables are from Malaysian CBG. First off, we have permethrin 5% cream or lotions, need to be applied for 8 to 12 hours and repeat 1 week later. Some patients might complain of itching, burning, or some stinging sensations on applications. Generally, this is a first-line therapy recommended by CDC. They are effective, well-tolerated, and safe. The second options that we have is benzyl benzoate, 10 to 25% lotions. They need to be rinsed off after 24 hours and then reapplied. They need to be kept on the skin surface continuously for 24 hours for 2 to 3 days with bath taken between each applications. They should not be used in pregnant and breastfeeding women as well as infants less than 2 years. Some patients may complain of some skin irritation as burning sensations as well, and they are generally effective and inexpensive. The third option we have is precipitated sulfur, 6 to 10% petroleum base. They need to be rinsed off after 24 hours and then reapplied every 24 hours for the next 3 days with the bath taken between each applications. They are generally low toxicity and safe for infants, pregnant, and breastfeeding women. The next we have on board is clotamidon's 10% ointment. For classical scabies, rinse off after 24 hours and reapply for 5 to 7 additional days. For nodular scabies, apply the nodules 3 times a day for 7 to 14 days. Some patients do complain of irritant contact dermatitis, and they are used generally for treatments of nodules in children. However, there are lack of efficacy and toxicity data. Needing 1% lotions or cream. should be rinsed off after 6 to 8 hours of applications, but we do not use this because of the side effects. The well-known side effects of linear 1% is neurotoxicity, which can cause cramps, dizziness, seizures in children. Next up, we have ivermectin, which is an oral drug. They are not for children below 5 years old or less than 15 kgs and should be avoided in pregnant and lactating women. They are suitable for patients unlikely to adhere to topical therapy, useful for mass treatments or outbreaks, and it is effective if combined with EBV in patients with AIDS. So this table shows the treatment in specific considerations. For infants less than 2 months old, the recommended therapy is sulfur 6% in petroleum in ointment base for 3 days. Children less than 2 years, permethrin will be the recommended therapy, and alternative therapy with sulfur 6%. Children less than 12 years, 2 applications of permethrin is recommended, or alternative therapy of benzyl benzoate. Adult, permethrin and benzyl benzoate. For pregnant and lactating women, permethrin is recommended therapy. And for crusted scabies, permethrin and ivermectin are recommended. These are my references for the video lecture. That's all for now. Kindly proceed with the post-lecture questionnaire. Thank you.